have found both the quality of the work that he does and the profound impact it's had a source of inspiration in recent years, and actually not a source of not a little envy as well. So I invite you, Dennis, to address this Scottish audience. We're very eager to hear what you have to say.
Thank you, Suzanne. Thank you, Suzanne, and thank you, Graham, for the wonderful invitation to be here. It's a great honor and privilege. I very rarely get to speak to any audiences outside the United States, so it's wonderful for me. I've never been to Scotland, so it's really been already a terrific voyage. I'm looking forward to the next few days being here. I did not bring this weather, although it's quite similar where I come from, so I was well prepared. But I do want to say I'm especially pleased to be here as part of this contemplation of what's going to happen ending homelessness here in Scotland. I would have thought the title of the conference, given the commitment, would have been Post-Homelessness 2012. But I'm glad that I understand that it's much more complicated than making pronouncements. And in the United States, we're very good at making public pronouncements against homelessness, and not always as effective in pushing them through. So we struggle with the same issues. I am, humbled by the fact that I'm an outsider, and I certainly can claim zero expertise on homelessness in Scotland. Much of what I know I've read from Suzanne's work and from other people who've written about, and Isabel and people who've written about the things happening here in Scotland. So I am somewhat familiar, but I'm going to admit that the remarks I'll make today are mainly focused on what we've learned in the States, and to the extent that that can apply in your context, I'll let you draw those conclusions. But I do think that one of the key things that might translate well is that it's important to have information and data and research like what Isabel and Suzanne and their colleagues are doing here. But equally important is to think through what are the implementation challenges and how can we be best stewards of public resources, because even if there is political proclamations, even if there's political will, there's still the lack of resources in all of our societies. And so we don't get a blank check to solve these problems. And the need always seems to exceed the demand that we have. So our solutions have to be thought of carefully in terms of matching the needs of the folks with the resources that we have to be as efficient as possible. So I don't want to sound like a typical American sort of capitalist, we have to be efficient and all of these sorts of things. It's really from a social welfare perspective as well that, we have to be good stewards of these resources if we want the public to continue to commit more funds to them. And we operate actually in a very different context in the States, and I just wanted to comment about that briefly before going into some of these results. And those of you who are familiar a bit with U.S. politics and social welfare might already know these things, but we have a much weaker social welfare system in the U.S. than is typical in the EU and certainly here in the U.K. We do not have a rights-based framework for understanding social welfare protection. Even in healthcare, you don't have a right to healthcare in the United States, which a lot of people might consider a basic right. And so certainly we do not operate in a context to a right to housing, and we don't have a right to income. In particular, our protections for people with disabilities are actually very weak. If you have a work history, then we have decent disability insurance. But if you do not have a work history, our disability coverage is particularly limited. And of course, the number one disability for people who do not have a work history, the disability that strikes when you're young, are people with severe mental illness, because most mental illnesses strike between ages 18 and 25 before you would accumulate eligibility for our main disability program. So instead we have a program called Supplemental Security Income, SSI, which is only about $640 a month maximum. Okay, so that is not enough to afford a market rate efficiency apartment anywhere in the United States. So these folks are particularly vulnerable when it comes to trying to get housing. But in addition to that, as of 1996, people with substance abuse related disabilities are ineligible for disability insurance. So substance abuse is no longer a category of eligibility. No surprise, the vast majority of our chronically homeless people in the United States have a substance abuse related disability. So, but they have literally zero income in most states in the United States, because we do not have a income support program for single adults in the United States who are not temporarily unemployed. And then lastly, a point I want to make is the context about housing support, which in the US, only 25% of the households that are eligible for a housing subsidy, these would be poor people who are eligible for a housing subsidy, only 25% actually get it. Okay, because those are only needed out by the legislature as they decide they want to give them. It is not an entitlement. Okay, so again, similar to social welfare in general in the United States, we do not operate within a very large entitlement picture. Just by virtue of being a citizen and being eligible does not mean that you get these services. So all of this only to reinforce my comment, which is that for us in the States, in order to succeed in dealing with homelessness, we have had to make a moral case, a political case, and an economic case each year as the budget is approved. We don't have legislation of entitlements to which we can point to and say we have to fulfill those commitments. We have to make the case on the basis of other points, in fact. One of the ways that we've been able to do it is to use research to say we have solutions that work, we have solutions that are cost effective, and we as an industry are good stewards of the public resources, and we are delivering a quality solution on an important problem. Please give us more. That's really what our approach is each year. And so that's sort of the context that we live in the States, and to the extent that you are able to translate some of what I'm going to show you today to your context here in Scotland, perhaps that will be helpful. All right, so I'm going to just actually go through 3 or 4 little studies that my colleagues and I did in the States using administrative records. And I see this homelessness software over here, and it caught my attention immediately because one of the things that our country has done is we have required that every community has to implement an information system across its shelter network. All of the shelters have to participate in collecting minimum data, including identifiers and dates of entry and exit from the shelter. In this way, a community can unduplicate the people who are served and look at their patterns of service use in terms of who's homeless for 1 day, who's homeless for 100 days, and what are their characteristics. So 2 communities in our country, Philadelphia in the United States and New York City, they started doing this back in 1980s in the case of New York City and in 1990 in Philadelphia. And now the rest of the country, about 400 out of our 440 communities, as they're defined, have now implemented these systems, and they're required under the law to do so. So it's been a very interesting, complex process. It has not been simple. There's been reluctance in the field to do it. There have been lots of training issues, lots of workforce turnover because the homeless sector doesn't pay the best, and so we have lots of turnover in the workers. So it's been an interesting process, but nevertheless it's enabled us to do research like I'm going to illustrate here today. So one of the things we did was we first started to look to see what are the different groups in the homeless population in terms of how they use the shelter system. And what you see here is we identified 3, and the red bars illustrate the percentage of the population that fell into each group. And we labeled them the transitional, episodic, and chronically homeless. And as you can see, the vast majority of people, 80%, are in that transitional category. Again, this may be due to the fact that we had such weak social protections and no minimum income. There's lots of people who slip into homelessness for a very brief period of time. The average length of time they're homeless is only about 3 weeks, and they leave and they don't come back, at least in a 3-year period that we observe. Actually, if you look at the length of time people are homeless, the most common length of time is 1 day, followed by 2 days and 3 days and so forth. So most people get to the homelessness system and they say, I'm out of here, I do not want to be here, I'm going to do anything I can, I'll go kiss and make up, get myself up by my bootstraps, do whatever it is, I'm getting out of here. And they do so successfully. And then there's a group, about 10%, who are in and out of the system. We actually believe that these are folks who spend time on the streets and only come into shelter when it's particularly bad weather or when they're sick. And then there's another group, about 10%, we label the chronic homeless, and they essentially are living in our public shelters. They stay there for very long periods of time. Sometimes in New York City, the average time is almost a year and a half at a single spell, without even a single day out. These are a very distinct population, as you can see, only 10% of the group. But the blue bars indicate the percent of the resources they're using, which in this case they're using about half of all the shelter days are being spent on this 10% who is in shelter for long periods of time. So in other words, if these were the shelter beds here, on a given day, half of them would be occupied by chronically homeless people. And this captured attention in policymaking sectors because people realized that these beds were never designed as permanent housing, but they're being used as permanent housing. So no one would ever think of designing housing that looked like a cot that was only 18 inches from the next cot, where you had to leave at 7 in the morning, come back at 7 at night, and indeed still we pay around $20 per night per bed for that. Okay, and in Philadelphia an apartment is about $21 per night. So no one would ever have designed it to look like that. So that sort of generated some political will to think, well, we could actually get rid of half of our shelter beds if we could remove this population and get them into appropriate housing. So it was a simple argument at the time, but it made intuitive sense. In terms of characteristics, as you might expect, as you go from this transitional episodic to the chronic, the population gets older, they are more likely to have a substance abuse problem, more likely to have a severe mental illness, and more likely to have a medical condition, a disabling medical condition. Indeed, just based on the admission records from the shelter, we didn't actually interview these folks, we could identify that 85% of the chronic homeless had some kind of disability. So this was a study that was valuable from another number of perspectives, but the implications we drew from it at the time, and we did this more than a decade ago, was we really should have several sets of interventions that are tailored to these groups. For the transitionally homeless, we should have relocation assistance and prevention. Prevent them from getting there if possible. We didn't have anything like that at the time. Relocations for those people who do become homeless that we can't prevent. For those episodically homeless, this turns out to be among the tougher population. These are the folks who sometimes won't come into shelter, and they're out on the street. And so we've created a whole set of programs. We call them safe havens, low threshold, low demand housing that is 24 hours and does not have rules. It's kind of a housing first program. So that's been the main implication for that population. And then for the chronically homeless who are living stably, I might add, in these shelters, we've been creating permanent supportive housing. That was the primary target. So that was our idea, was we should have sets of solutions that are matched to the population and that they are sized appropriately given the demand for the different groups. Another study I want to just show you briefly is one that we did looking at a particular housing intervention that was undertaken for the chronically homeless in the United States. This was the biggest intervention at the time. It was initiated by the state and the city of New York to develop 3,600 units of supported housing targeting chronically homeless people with a severe mental illness. So it's specifically targeted to people with a severe mental illness. And to do this project, we basically matched up the shelter records, the names, birth dates, and the social security numbers with a whole variety of public sector service databases. So DHS is the shelter, OMH is the psychiatric hospitals, HHC, as you see there, is the public hospital system in New York City. There's 13 hospitals. Medicaid is the insurance for hospitalization in private hospitals, and that's both inpatient and then there's outpatient. VA is hospitals for veterans, and then we had prison and jail. And so we matched about 10,000 people. There are 5,000 who got into those 3,600 slots over an 8-year period, and we matched them with 5,000 who didn't get into those slots, but who looked just like them. And we followed them each 2 years prior to their getting into the housing, for those who got into the housing, and 2 years after. And when we looked at the whole 10,000, in their time before the housing placement, we tallied up the number of days they spent and the dollars that it cost, and found that the average person was using $40,500 in services per year. And at the end of that year, they were still homeless. Okay, so that's a lot of public resources that were being spent. You thought it was expensive to have an apartment in New York City. This is how expensive it is not to have an apartment in New York City. So we found that these folks were cycling in and out of hospitals and jails at great public cost, and that unless you took this broad look, you really wouldn't necessarily see how expensive they were. Some people were looking just at the shelter or just looking at jail, but if you put it all together, you could see how expensive it was. But when the folks were placed in housing, they reduced their rates of hospitalization, their rates of incarceration, their rates of time in shelter, such that they reduced the total of $16,000 per person per year. So that was a substantial decline in their use of these expensive services. And this was adjusted for what happened to the control group. And in terms of how much did the housing cost, now remember, in this case, the housing included a housing voucher, which is the equivalent of paying someone's rent, except for the tenant puts in 30% of their income. And then a support service package, a mobile support service package that visits the tenant weekly, more if necessary, less if necessary. So that total package turned out in this case to be about $17,000 per year. We now do it for $12,000 per year, but when this program was first launched, it was done to make sure it would work, and so we were more generous in the service package. So in other words, it was nearly a break-even proposition, as you can see. Reduced their use of services by $16,000, and the program cost $17,000. So the net cost for each housing unit per year was about $1,000. So that's a good deal from the public's perspective, from the government's perspective. We were able to show that 95% of the cost of this intervention was returned back to the taxpayers. Okay, there are not many public expenditures that the government will do that will do that. So in the case of New York State, just to put some numbers on it for you, it's about $65 million a year to fund these 3,600 units. They would get back $56 million of that. So not bad, and there was a substantial decline, obviously, in homelessness. And think of, this is not even, of course, to mention the quality of life change that occurred for the individuals, the transformation that occurred in all these individuals' lives. So I was asked by the Bush administration in 2003 to sign on with them as a consultant and to work with them on a federal strategy to create more permanent supportive housing to end chronic homelessness in the U.S. Many might find that a surprise that George Bush wanted to end chronic homelessness, but it happened. I'll tell you later why. But at the time, what we did is estimated that about 180,000 people were chronically homeless in the United States, and that we would have to come up with these rental subsidies and service supports. In some communities, we knew there would have to be new construction, although in many communities, most cities in the United States run at 8 to 10% vacancy in housing. It's only a few cities, a handful of cities, that have low vacancy rates. So we knew there was capacity. What was done was between 2004 and 2010, our government increased spending on homeless programs by $400 million a year. About 80,000 units of permanent supportive housing have been created. And at the last count that was just done to look at the number of chronic homeless in the United States, they pegged the figure at 109,000, which is a 36% decline from where it was in 2004. So this was very important. So you can just see that a few pieces of information were very key to get this done. One was we were able to identify the small population, relatively small, that we were talking about that was chronically homeless, show that we were wasting resources on them. We had an intervention that worked, that actually saved money. That led to the political will to spend a lot more. And then we had a computer system out there, an information system infrastructure to collect data to show that, in fact, we had reduced chronic homelessness by a third. All of those pieces were necessary for us, And I'm glad to say that it is continued. Despite all of the cuts that are happening in the U.S., the homeless programs have not had any cuts. In fact, we had a little increase last year. We're flat funded under the President's budget for this past year. Going forward, we have an increase this year, but nevertheless, we have not been affected by the cuts. And I think that some of that is due to the political will on both sides of the aisle that has been generated because we've had some decent numbers and decent research to support it. Okay, switching now to family homelessness. About a third of the people who are homeless in the United States are in family households, which means it's a household with a child under the age of 18. As a household type, they're only 13%, I don't mean to say only, but 13% of the homeless households are family households. As people, they're one-third. But the majority of homeless households in the U.S. are single adults, what we typically think of in homelessness in the U.S., and most of them are male, as you can imagine. But it is very important. Homeless families are a very significant subpopulation. They attract a lot of political attention because of the fact of homelessness affecting children. It also tends to be heavily funded, so there's a lot of dollars going into homeless programs for families. So it's a very important population for us to be looking at, as is any of the homeless populations. But we did this study to see what would it look like if we were able to do the same kind of typology. Would the families look similar to the single adults? Because the advocates for families, some of them were a little put off by all the attention going to the chronic homeless. And they said, hey, how about some resources for the homeless families? We have chronically homeless families too. And I was a little put off by that because I don't believe that there are many families who have the profile of the chronic homeless person. If indeed they do, they usually lose their children to the child welfare authorities. So I didn't want to jump on that bandwagon, but I said, let's take a look and see if the data supports that conclusion. We knew going into it that families have much lower rates of mental illness and substance abuse than the single adults. We knew that if you compared poor families who are homeless and poor families who are not homeless, they don't look very different. So we had going in an idea that there's more homogeneity among the homeless families. And then lastly, we knew that there were a lot of policy factors that were driving families to stay in shelters for a long period of time. One of which was that it became a waiting line to get into our subsidized housing system. We had priority for subsidized housing if you were in a shelter. So it was an incentive for people, even if it wasn't an incentive to get into shelter, it was an incentive to stay there. Because as long as you waited, you would be guaranteed with the placement. So we ran the analysis, and at first look, it looks pretty similar. Again, the vast majority of the families are there for a short period of time, 75%. So just like the singles, they show up, they're in an emergency crisis situation, but they don't want to stay. They leave as quickly as they can, and they don't come back. There's a much smaller group, about 5%, who return multiple times. Okay, so there is a group, much smaller, who return multiple times. And then the long stay families, twice as many as among the singles, even though we know they have lower rates of mental health problems and substance abuse problems, but there are twice as many of the families were long stayers. As the blue bars indicate, we had the same phenomenon. Half of the resources were being spent on this relatively small group of people. So that could be considerable. I'll explain in a moment. When you looked at their characteristics, this is where the typology failed. It did not meet the same criteria. It didn't have the same theoretical validation as the singles. When we looked at the characteristics, the families who are staying the homeless the longest actually looked better than the other families in terms of their behavioral health, their involvement with the child welfare system, or having any one of those things. So in terms of substance abuse, mental health, or child welfare involvement, they had the lowest rates of involvement of the rest, which would be contrary to what you would think, right? You would think the longest homeless were the most troubled. In fact, the longest homeless were the least troubled. And in terms of income, the longest staying homeless were the most likely to have a job. Almost half of them had employment, and they were the least likely to have disability income, which is what SSI is. That's disability income. So and then when you look at the dollars being spent, this was pretty eye-opening for some people. Even short-term homelessness costs almost $12,000 in the United States. That would cover a year's rent in even the most expensive housing markets in the United States. And look at the long-term homeless, $50,000 almost per family for their episode of homelessness. That would be the equivalent of 5 years of having an apartment with their rent paid. Or 5 times as many families could have been served in an apartment for the same cost as one family in a shelter. And, by the way, they're not disproportionately needy than the other people. So clearly, this suggested that there's something broken here and there's a need for reform. We concluded that it was really public policies and programs that were driving these long stays. Many of the shelters that were designed for families on a transitional basis actually screen out some troubled families, because they want families who are going to become successful and maybe even homeowners and employed. So they actually, believe it or not, some of them have criteria that screen out families. Oh, they're too troubled for us. We're a homeless program, but these families are too troubled for us. And then they have a concept that people should stay for 18 months to 2 years and graduate. So it's almost like it's a boarding school concept or a finishing school. And they get, special programs. So by the end of the day, the people who graduate, well, guess what? They look healthier and better than the people who fail out. Okay? The people who drop out or get evicted. You can get evicted from homelessness in the United States. It's pretty bad when you get evicted from homelessness. But in fact, that's the way these facilities operate, and they consume large amounts of resources. About 60% of the federal dollars that go into the homelessness assistance system go to transitional housing programs for families. So a lot of resources are going into a program that basically doesn't work. Okay, because the outcomes, by the way, are not any better than the outcomes for people who stay shorter. So anyway, we decided there was a need for reform. So now I come to sort of the last phase of this talk, and I'm wrapping up. Am I over my time? I'm okay. So what we decided to do is, in light of these conclusions, we said, let's step back. The homeless system, if we can call it a system, we call it a system, but it's really just a hodgepodge of heroic people who are out there fighting the good fight. But no one ever came along and said, oh, we should build a system that looks like this, and it operates under these principles, and this is the way it should go, and these are the outcomes we should have. We have only put those things on top of these programs 20 years later. These were programs that were started by the saints in your community, the Mother Teresa of every community. I'm sure you have several here in Scotland. People who championed the causes of people that no one else was caring about at the time. So I feel a little trepidatious about trying to impose a framework later on. So I say, let's step back and say, if we were to start this program over and say, how would you design a homeless assistance system that was consistent with social insurance principles? What would it look like? So that's really what I'm intending to do here. Most social insurance programs are designed with some kind of efficiencies and incentives in mind that create this particular kind of utilization line. And that being that most people have relatively less complex issues, and they can solve them very quickly with little resources. And there's a few people who have more complex needs. It takes more resources to solve their problems. So essentially, we want to have a system that's designed that works in this same way. Okay, so the idea being most people would go through high volume, low intensity intervention, and you would have reserved your high intensity intervention for the lower volume of people with more complex needs. So I got you there, you're with me. So in the homelessness arena, we would put prevention on the one hand and what we call supported housing on the other hand, which is a voucher with support services that are mobile and come to you. So obviously our most disabled population goes in there. But prevention being the sort of light touch interventions that are on the other end. And I know you have all of these things here in Scotland, so I'm preaching to the converted, but I'm just trying to help you see where we came to this. So where does the homeless system fit into that? We really saw it as really an intermediate space. And we saw that community-based programs should be doing prevention. It should not be the homeless assistance dollars, because we have a very limited amount of dollars that are dedicated to homeless assistance. And we didn't think it should really be spent on prevention. We have mainstream social welfare programs. We need to make them work for the people who should be accessing them. And we can't expect it to come out of our little homelessness pot. And then we, in our homeless system, we run the shelter system, and there are some people who stay and who can't get out, and they should go to permanent supported housing. So that's the basic concept. But what we realized in looking at the system was, especially in the States, is we had lots of programs for the homeless. We had health care for the homeless. We had shelter for the homeless. We had dental programs for the homeless. We had legal aid programs. We had some schools for the homeless, scandalous. We had transportation for the homeless. But we didn't have a program that got homes for the homeless. Okay, it was the one thing that was missing. Everyone was getting paid to take care of the people while they were homeless, but no one was getting paid to actually solve the problem. And a glaring omission, okay, except for the chronic homeless. But for most people, we got paid to make sure you had a clean bed and you had a hot meal, and then at 7 in the morning, now go outside and come back at 7 at night, don't get in any trouble out there. Okay, that was basically what our program was. We didn't have anyone who dealt with you while you were awake. We stored you in homelessness when you were asleep. We didn't really deal with you when you were awake. And so we decided that, this is the missing piece, okay? And so this green box is really designed to be that piece. So let's divert people from homelessness if we can at the front door. If we can't, let's relocate them as quickly as possible. So it's sort of these same housing first principles you have adopted, housing-led approaches. And then let's get folks transitional rental assistance, because we don't have money for permanent housing vouchers for everyone. But we could maybe provide 6 months, 12 months, 18 months, 24 months rent on some basis. And so in fact, this is the program that we adopted. In 2009, when President Obama came into office and the economy was falling apart, and there was political will to support what was called the Stimulus Act, they went around to each of the federal programs and said, what could we do to spend money fast that would help mitigate the effects of the recession? And in the housing world, we said, let's fund this green box. We've never done it before. Let's fund what was then named the Homelessness Prevention and Rapid Rehousing Program. It was the first time we ever spent money on solving people's homelessness. $1.5 billion, about $500 million a year. We didn't have a lot of experience in the States with doing this. We stole a lot of ideas from the UK, especially from the English experience. We read Hal Paulson's evaluation of the British or the English program, and we adopted many of these same ideas. So we now have many of the things that you folks had, but we didn't have it before. But unfortunately, the funding ran out in this program in November of last year. It has become embedded in the new federal legislation. So I'm just going to conclude with a few remarks here. Basically, as I said, we've stolen some of your thinking in terms of what we're doing in the States now around homelessness prevention and rapid rehousing. But lacking this rights-based framework, we have had to rely on research data. We have to show effectiveness. We have to show that the spending is not just going into a black hole of compassion. Yes, we all love to spend money on the homeless, but where is it going? But they actually have a conceptual framework about how this money is going to be spent, how it would be efficiently spent, and I think that may be something that could translate in your context as well, because even though there's a commitment to end homelessness here, I'm sure there's limited resources from what I read. You have tough economic times as well, so perhaps this is all imploring you to collect more data, do more research, support Isabel and Suzanne and their colleagues as they try to help you build a more effective infrastructure. Is that a good plug? But as always, I admire the good work, and I'm looking forward to learning more about all that you're doing here in Scotland. Thank you. Thanks, Rob. Oh, yes.
So, any questions for Dennis?
Yes, in the back. There's a microphone roaming around.
Hi Dennis, thank you very much indeed. That was very interesting. My name is Alistair Cameron, I work for Scottish Churches Housing Action. We did some work to local authorities last year about the 2012 target and the progress towards it. And one of the things that struck me was that many of them are very concerned about those people who don't engage with the local authority in its response to homelessness. I'm sure that is something that we have in common with the United States, and I just wondered what you have to say about your experience of working with people who probably are at the chronic end, who you want to do the best for them, but they have antisocial behaviour tendencies, they make life a misery for everybody around them, and so on.
So, we have very similar, obviously, subpopulation, and we have a fairly aggressive approach to outreach because we have been trying to address chronic homelessness now for almost a decade. There's a fairly aggressive public street outreach initiative in almost every community. And the experience of these street outreach programs has been that people can get engaged. It takes a while to build trust with them over time, that there's a relationship building process that's required. It's not as simple as just sending some people out to, see them once or twice and think that it's over, but it really is an engagement process. But the other thing that has been learned is that you have to have the solution ready when the person is ready. And so for us, the term housing first has traditionally applied to this concept, that there's a whole group of people for whom they've never been able to make it into the transitional programs or even the housing programs that require sobriety or they require you to engage in treatment. Many of these people are suspicious of treatment. They have not had a good experience in the mental health sector. They have not had success with substance abuse treatment dozens of times. So they're not willing to go through those procedures. So having a housing unit for them to be able to go into immediately turns out to be very important. And I mean like that night. So in places that have really truly implemented a housing first approach, they usually have a stock of units, oftentimes under a master lease agreement, where they can bring someone in with the intention that they have their own unit. And this is actually the idea behind safe havens as well, that they're small, they tend to be no more than 20 people in a building. You have either a private room or a semi-private room, and there's no rules except no smoking in your room. But it's a way for people to get off the street and they know there's no rules. You don't have to be in treatment, you don't have to talk to a psychologist, none of that's required. But the idea is there is an immediate solution, and then the goal being within 30 to 60 days, they can be transitioned into a unit that they can lease on a longer-term basis. That's what the Housing First program has been in the States, and that is what has been successful, even with these these populations who resist services the most.
Other questions from David?
Hi, Val Holt from South Lanarkshire Council. I'm interested in who owns the housing. You talk a lot about housing programmes and supported housing. I think one of the problems we've had in Scotland is that in the past we had a lot more social rented housing than we have now, and we've increasingly, I think, found ourselves in a position where we have a homeless population, if you like, competing with ordinary people who want housing, and that has, I think, caused some difficulty, and it is quite difficult to access the private rented sector. So in the States, I'm not sure, I don't think you have social housing.
That's
so
right.
Who are you leasing it from?
Yeah, so these are mostly private rental units, the majority of which we call them scattered site. So it's not a building dedicated to this purpose. It's just a rental unit that's mixed in with others. And it requires that our housing intermediaries, the organizations who actually locate and secure the housing for people, they have to cultivate relationships with landlords. They have to be fairly aggressive about going out and finding landlords who are willing to participate. And landlords are willing to participate, it seems, when they know that there's a social service agency who is going to back them up when they need help with this tenant, that they don't have to deal with the social issues that the tenant may have, that someone else is there to call if there's an emergency or a crisis. So it's a combination of aggressive work with landlords and then also having the social services that are there on call 24 hours a day. We do have some non-profit private housing developers who develop a building here and a building there, some of which may be 100% formerly homeless, some of which could be mixed income. And that's the closest thing we would have to a social housing sector, but it's very small, relatively speaking.
Okay, we have one more. Right here.
I just wanted to ask a question about your outcomes. You started funding being posted, you're saying that funding has dried up. Have you seen the financial savings that allows you to become self-financing now that you no longer, you could intervene earlier and you no longer have those really high level costs for your long-term homeless?
So with regard to the long-term homeless, I think the case has been convincingly made to state and federal government that there are cost offsets, and for many of the population it's actually you save money. But you don't save money on everyone, okay? And it's important to note that. But maybe across, when you pool the savings, you can come up with neutrality. But you have to have the high-cost people and low-cost people together to achieve that. So I think that case has been successfully made, and we have more resources going into that. But the case has to be made each year, because we have to get incremental increases each year, so you're always in a budget battle, competing with every other program out there. So that remains a case that has to be made on an ongoing basis. With regard to the rapid rehousing and prevention programs, there has not been a cost-effectiveness study that's been done on that. There is a study underway that's looking at cost-effectiveness of those programs. We actually have several that are underway that are looking at that. So we will have some evidence, hopefully, in the near future as to what is the cost-effectiveness of those programs, because that is a key question going forward to build support for those programs as well. Okay? Thank you.
Dennis, thank you very much indeed. Thank you again for that presentation and for everyone
National Mayor
for
Secretary.
making that possible. Thank you very much. Thank you.